All right, hey there. That's Wilfred Reilly, I believe. Am I not correct in that?
It is I.
Wilfred Reilly, he is Associate Professor of Politics at Kentucky State University. He is the author of, what do you call it, Hate Crime Hoax? Is that the earlier book in which you actually debunk a lot of public discussion about the frequency of hate crimes, especially against people of color? And more recently, just coming out from Regnery Press, Taboo, and then there's a subtitle. Will, what is it?
It's 10 Facts You Just Can't Talk About. And yeah, those are my two, at least, mass market books. Hate Crime Hoax, which I think we chopped it up about on this.
We did talk about this 6 months ago or so.
Yeah, that's a book that looked at a lot of these very high-profile hate crime incidents. Jussie Smollett, Covington Catholic, if you want to throw that in there. Yasmin Saweed and the torn hijab allegedly on the New York 6 train, Duke University's lacrosse team, Drake University, Goucher College, Wisconsin Parkside with the nooses,
okay,
College with the death threats to every.
I got it. There's a long list.
Yeah, you could throw in Erica Thomas. But yeah, I looked at a number of the highest profile hate crime or hate incident allegations in the USA. And I found that a very large percentage of them, which I estimate is 15% overall, and more than that among high-profile cases, more than that by far, turn out to be fakes. And in many cases, as in Mr. Smollett's, that's undisputable. That's not debated among serious people. So I look at why this is. I look at the culture that's grown up around victimization on, in particular, university campuses.
Well, I don't mean to interrupt, but we've already discussed the book at the Glenn Show. So I think people can look up in the archive. It wouldn't be hard to find. Tell us about Taboo.
Taboo is my next book. And the idea of taboo, obviously, if you participate in online or cocktail party debate at all in modern America, one of the things that comes up is this concept of cancel culture. That there are certain things you just can't discuss or that are impolite to discuss. And that's gone well beyond religion and sexuality to include a lot of race issues, a lot of class issues. So Taboo essentially looks at 10 of these issues. Chapter 1 looks at whether there's any logical basis for the Black Lives Matter movement. Chapter 2 looks at the reality of interracial crime. There's very little of it, and it's very heavily minority on white. A couple chapters look at the idea of culture and performance, race and IQ, that sort of thing. I have a consolidated chapter that takes on the idea of white privilege and cultural appropriation. These are, to a very large extent, not real ideas and that they're not scientifically sustainable, modelable ideas. I draw up, with an utter lack of arrogance, I draw up an ideal immigration policy for the USA in Chapter 9.
I noticed that.
And Chapter 10, the modesty.
Yeah, well, you say if you were emperor or king of America, something like this is what the policy would be. And then you proceed to propound a number of what I think would be highly controversial proposals. For example, IQ test as a condition of granting a visa to somebody to come to the United States.
You're damn right, Glenn. I mean, so
we'll get into this more in due course, but just know that this guy is an iconoclast or a contrarian, man after my own heart. Anyway, go ahead.
And Chapter 10, I take apart some of the crazy ideas on the right. I mean, I look at the idea of ethno-states on the quote-unquote alt-right, the idea of a religious or theocratic society, the alt-right, again, diverse societies never succeed. And a lot of this is just fantasy. I mean, diverse societies do need a core civic ideal, but I mean, they've been successful since Rome. We're not going to break up into small countries where, Black conservatives get Alabama, but white alt-lightists get Washington. So I do focus on some of the things on the right that I consider bizarre, illogical as well. But most of the ideas in the discourse right now that fit that description do seem to be coming from what you might call the SJW left. So I kind of line them up and to the best of my abilities, take them down.
Okay, so that's what the book Taboo is about, and we'll get into some of the details in a moment. But first, I have to take advantage of the fact that you are in Western Kentucky. Hey. And this is, we're speaking now in the midst of this coronavirus pandemic and the national shutdown for sheltering and in place and social distancing and the fierce debate that's raging in the country about how to respond, both in terms of economic relief, in terms of public health policy, in terms of the quality of leadership coming out of the White House, in terms of deference to expertise. These are all live questions that are being bandied about. And I'm just wondering what it looks like from Western Kentucky, because last time I checked, that was flyover country. That was not, at the center of the media's radar. That was not the place that you would first go to try to find out what Americans are thinking. But it's a place what I'm very interested in. And what can you tell us about what's going on? How is social distancing working in Western Kentucky? What's being written in the editorial newspapers about the impact of the pandemic? And who are being the populations hardest hit in your part of the world, et cetera?
Well, Western Kentucky looks a lot like America, I suspect, when it comes to coronavirus, and not a lot like what you see on TV from the New York hospitals. And this is something that's very notable when we talk about this disease. And this is something that's led a lot of governors, like the governor in South Dakota the other day, to suggest sort of a regional response to the bug, as opposed to taking the New York City methodological models and trying to apply those to Montana, for example. So in Kentucky, there are about 1,000 confirmed cases of coronavirus. I believe we've had 59 deaths. People are certainly following the rules that most of us think of as social distancing, give people 6 feet of space in the store, wash your hands, that kind of thing. But I mean, a very large number of businesses are open as essential. The newspapers, the Courier Journal.
Excuse me. Is there a statewide shutdown order in Kentucky?
Not really. There's first of all, there are a lot of questions about legality of those and what a specific shelter-in-place order is. In Kentucky, what we have is what's called a healthy at home order, which I've read in my role as a college faculty member, and I suppose you would say executive. I'm our faculty ombudsman on that side. The governor strongly encourages people to remain safe. It's that sort of language. So grocery stores, laundromats, I mean, a number of what you would think of as retail outlets, although not, clothing stores, that kind of thing. About half of all businesses are open. And people are taking that exercise suggestion pretty seriously. So you see people on bikes, running, so on. So again, people are following the rules that you associate with the disease environment, but there's not a whole lot of panic. I obviously have friends in the medical community, and one basic point is that our hospitals aren't flooded with people. That's just a fact. In fact, in a lot of kind of heartland areas, talking to people in that community, and for example, Tulsa, Oklahoma, Lexington, KY, West Virginia, a bigger issue for hospitals is that they've been ordered to stop performing most elective procedures to make way for this quote unquote wave of COVID-19 patients. But which has not materialized. Which is not there. And which, speaking from a methodological numbers perspective, is probably not going to be there. If you follow the major models, let's see what it, but okay. So if you follow the major models that the US government is using, such as what's called the UW model, the peak of the coronavirus epidemic is projected to occur in about 4 days. The projection figures go from April 12th to April 15th. And it now
is that a nationwide claim, not specific to particular regions of the country?
It's a claim about the maximum number of infections and deaths across the country. Right. Now, I suppose you could see a state peak after that.
Well, you will be seeing that because there's a very different epidemiological dynamic going on in Washington State than in California, than in New York, than in Kentucky.
Sure. But I mean, I think that, again, though, if the national epidemic has peaked, you would then have a greater range of PPE and medical equipment available in neighboring states to help us out if we did see that worst case. Quite frankly, again, most physicians and so on in urban or ex-urban areas in the smaller states, their comment is that they're seeing a decline in hospital traffic. You're no longer seeing any elective surgical admissions, plastic surgeries, anything like that. And this idea that we're going to wait and see if there's a coronavirus flood while we're not doing 85% of what we do has actually caused some hospitals to engage in layoffs. Good buddy of mine lives in Tulsa, and their largest hospital recently laid off, I believe, 600 people, furloughed them for at least a couple of weeks because they're not doing anything that they normally do, and they're also not seeing the COVID surge. So,
although you could argue with the uncertainty around the way that the disease is going to propagate, that it's better to err on the side of being too careful about this. The surge didn't happen or hasn't yet happened to the extent people predicted, but it might well have done it. It might yet do. And therefore, I can imagine an argument like that.
This is the debate, right? And I mean, okay, I think this goes for you as well, Glenn. I think this goes for everyone in these conversations on both sides. No one wants anyone's grandmother to die. No one wants anyone's business to go bankrupt. Let's assume that is a starting point. I mean, we'd all like to mitigate any potential harms as much as possible. I personally feel, and I feel this way as someone who teaches quantitative methods classes at a solid state university, not just in my personal capacity, I feel that we've erred extremely far on the side of caution, or we've chosen to project extremely far on the side of caution. So the reason for this really is one statistical model. Looking at the methods blogs, talking to my colleagues in academia or in the medical field across that line, looking even at Twitter. Neil Ferguson, the British methodologist, around March 14th, I believe, wrote a short paper where he calculated that 2.2 million people could die of coronavirus in the United States.
Excuse me, that's out of the Imperial College, University of London, if I'm not mistaken?
Yes, Dr. Neil Ferguson, Imperial College. He's been described as the man who shut down the world. I don't think that's entirely fair. But essentially what he did, and that's not my description, I have to source that, look that up. But what he did essentially is say, if three things happened, we could see this very large number of deaths. Thing one is a very high infection rate approaching 80%. It's worth noting that that's very atypical when you look at flu-like diseases. There was an entire cruise ship, the Diamond Princess, that was adrift for weeks with coronavirus patients on it. Their infection rate was 17%. So, okay, 80%.
Yeah, may I just mention that that's Ioannidis, the Stanford scientist who analyzed the data from that cruise ship, and wrote a very strong, I thought, piece in which he said, let's go slow and think carefully about what we're doing because we really don't have the data to make hard and fast conclusions. And what data we have suggests that it might not be as virulent as many have said.
That is absolutely correct. I would strongly recommend that article by Ioannidis from Stanford's team. In the coronavirus pandemic, we're making decisions without statistical evidence. That's exactly correct. I feel the same way you do about that, Glenn. But essentially, Ferguson's first estimate was 80% infection. His second estimate was a 1% or nearly 1% fatality rate among the general population. We'll get into that in a second. And his third estimate was that his third baseline here was that we don't do anything to mitigate. And Ferguson himself has said that he included that to some extent to be provocative, to show a potential worst case. No one assumes that we're not going to mitigate. But I mean, just to take some numbers here, I mean, Ioannidis said that if you take the death rate on the Diamond Princess, which is a bit under 1%, and you plot that against the age graph of the population in the United States, if that makes sense. The old joke is that cruise ship passengers tend to be newlyweds or nearly dids. Average age on the ship was something like 65. I'd have to check that. But if you take that data and you plot it against the actual U.S. population, you're talking about a death rate of 0.125%. So all I'm going to say here is that if you take those alternative numbers, you take 0.125%, suggested by one of the better methodologists in the world, you take 20%, which is the undisputed infection rate in a closed environment where people were there for a month, and you assume mitigation, you're all of a sudden talking about a 20th or a 40th of Ferguson's estimate. So we have chosen to be cautious based on this Ferguson model and a few others. But as you mentioned, there are direct responses to that.
What is the political character of the discussion in your part of the world right now? Are people more or less happy with the way that the president is conducting his responsibilities at this critical time? Are they clamoring for more, rigorous government policy or whatever? How are people taking the economic hit, this kind of thing?
I'm going to try to be polite and tactful here because
please do.
No, because I have a professional job. But no, people people are not clamoring for more harsher government measures. Most people are aware that there is a disease epidemic going on. They're willing to wait things out somewhat. But I mean, I've heard many, many more people say this is ridiculous. They're shutting down things like jogging trails. There's no way you could possibly infect someone. Then I have heard people say what we need is a national in-house lockdown. And I think that's very typical of most of the quote unquote flyover states where, again, you have 1,000 cases or 5,000 cases. I will say, I mean, there are 4 million people in Kentucky, and Louisville is a city of more than 1 million people. So we don't have a tiny population. I mean, there is a very, very low detected prevalence of COVID-19. And I think many people looking at that and looking at how skillfully most people are social distancing, we don't have some of the issues with that you might see in, for example, New York, are kind of wondering more, when will this end than should we institute a national lockdown? And I think this is a situation where you really see the influence of the media and the influences on the media's perspective. Because, I mean, the national mass media is based in New York, LA, and DC. Those are hard-hit big cities. So you constantly see these columns in the Times or the Post, like, we need a national lockdown now to save millions. That's not necessarily the perspective of most people. It is extremely easy to stay 6 feet away from someone in downtown Frankfort, Kentucky. It might not be on the NYC subway. I grew up in downtown Chicago. I'm familiar with this. But again, that's why so many governors have called for a regional approach. If social distancing works in a large farm and fleet style store in Kentucky, there's no reason not to go with that approach. If that would be virtually impossible in the Chanel boutique, on Park Avenue, you might need different rules and regulations there.
Okay, now you've heard these arguments, and I'll just say them for the sake of our, discussion here. If you don't do it universally, it doesn't really have the same impact because the virus doesn't respect regional boundaries. And even if you don't have a high incidence of infections or deaths at the current moment, you still might have asymptomatic carriers, et cetera. So that if you don't have a universal shutdown, you risk not getting the benefit of the shutdown in the areas in which you have it.
Well, that's one I'd leave more to the doctors, but I will say I don't personally see the logic of that at all. I mean, if you're talking about an area like Montana, where it's extremely easy to keep the 6 feet that prevents the spread of most transmissible diseases, this has been known since the Spanish flu, and people are maintaining that distance and are following other protocols like hand washing, logically, unless all of modern epidemiology is wrong, they won't get the disease. So I don't see how they could then spread the disease, which they apparently would not have, to other individuals. I also think that there's an element of kind of back-assedness to that. I mean, when people are saying, well, those people from thinly populated southern states could come to New York and infect us. I mean, that's not necessarily what we've been seeing. I mean, I think what we've actually
Well, they might be saying, that somebody from Cincinnati will cross over the river into Kentucky. And if Kentucky's not locked down and Ohio is, they're going to go, for their recreation or their shopping or whatever it is, and they're going to bring the virus with them.
Well, but I mean, the issue there, now, again, there are trade-offs in reality. The question is, what level of risk are we willing to shut down the world's powerhouse economy for? So that's the flip side. I mean, I think that, doing some risk analysis there, if Kentucky is properly socially distancing, and as soon as that guy gets back to Ohio, he's locked down, I don't see how you're going to transmit the disease in an R higher than 1. So, I mean, I actually, I was hesitant to say this in this format, but I mean, as someone in a decently significant local role, I mean, there's some things that I would suggest in terms of combating coronavirus. The first would be random serological testing. And I think that's where the debate really needs to begin. Because the most significant issue with coronavirus is that there's a denominator problem, as I think you phrased it. So frankly, we don't know how many people have coronavirus, and this is unbelievably significant. It's extremely difficult to get a coronavirus test. I was flatly refused for one by my physician. In most states, and I believe this is still true here, it's true as of a couple days ago, to get a test, you have to be very sick, i.e. symptomatic. You have to be able to demonstrate that you were in contact with someone who had coronavirus, and they're probably going to call that person. I know they did early on. you have to be willing to contact a hospital and ask for this scary test and then go through a 30-minute screening process. So the pool of people that we know have COVID-19 is the pool of people who are very symptomatic, who had personal intimate contact with someone with coronavirus, and who passed through the 30-minute screener. That's an extremely selected sample. I mean, in the entire country, we've given less than 2 million COVID-19 tests as of Worldometers 2 days ago, and we're seeing something crazy like a 30% positive rate for those. And that implies to me that there are many, just by definition, there are far more people that have COVID-19 than that have tested positive for COVID-19. If you don't meet all of those criteria and you call a doctor and say you have COVID-19, you'll be told to stay home for between 1 and 2 weeks. That's it. So, I mean, a team from Stanford University, which includes Dr. Ioannidis, who we've been talking about, has estimated that the actual fatality rate for coronavirus could be as low as 0.08%. And their source for that estimate isn't just making it up, which is the problem with some of these models, frankly. It's looking at testing data from the VO province region of Italy, from Iceland, and I believe from Belgium, where random tests have been done to see how many people test positive for coronavirus. And in Italy, it was 3%. Iceland, it was 7%. Belgium, it was 8%. And all of those tests used are from serious players like Decode Genetics, very low rate of false positives, you'd say 1%, perhaps. You can call that the margin of error. But the indication there is that more than 5% of all people have contracted COVID-19 over the period of time that the epidemic's been raging. Possibly more. That's probably just the percentage that have it now. So anyway, the conclusion of all that would be that if the deaths that we're seeing, a total of less than 13,000, come from, say, 5% of the U.S. population, 16.5 million people, rather than from 300,000 positively tested individuals, we're looking at a fatality rate about on par with serious flu. So the first thing that I think should be done, or I suppose that I would do, is a series of large and random, preferably serological tests to see what the actual infection rate and actual death rate are here. And I mean, and there's not.
I want you to explain to people what you mean by serological tests. I'm not sure everybody will understand that.
Sure. There's a distinction between tests that show current positivity for or infection by the virus and tests that show antibodies for the virus. I would prefer that tests that show antibodies for the virus be used just from a methods perspective, because that would mean that everyone who's been infected could be detected rather than just everyone who's infected now.
Yeah, I just want to underscore for the viewership. I mean, the point here is that it's the denominator problem. You want to know how bad this is? You can see everybody who's sick. You can't see everybody who might have been sick carrying the virus but didn't get sick. And if you don't have random testing of the population, if you only have testing directed by the presentation of symptoms, you'll never count those people who have the virus but who do not get sick from it. And therefore, you will risk overestimating the deadliness and severity of the virus.
Yeah, the Stanford team, I like simple points in science where you don't have a lot of postmodern jargon. You just run your model and you see what the numbers indicate and then you write it up. The Stanford team makes a really, really obvious point, which is that these terrifying death rates that we see, we're at 3.1% right now. I think if you look at new cases, resolved cases, the full block of cases together, 3.1% death rate, that sounds terrifying. However, again, the issue is that is strictly out of the pool of highly symptomatic, sick people who were in direct contact with someone who we know had the virus, who asked to go to a hospital and take the test.
Yeah.
So the Stanford team's point is just that if you take the results of the random testing, you're dividing that figure by whatever it was, 56. And that gives you the actual death rate. Actually, I think in Italy it was 116. So if you take the death rate and you place that over 116, you're suddenly looking at something that's much less terrifying. And that is, in my opinion, more likely to be accurate. We keep hearing these apocalyptic predictions. We've already seen the start of a viral curve, but right now we're at 12,800 deaths, not 2 million. The epidemic's peak is projected to be nationally, your point there is correct, but nationally in 4 days. So it's hard to jump from 12K to 2M. I mean, there had to have been a mistake in this modeling.
Well, I think we're starting to see some drawing back and some corrections within the specialized scientific community as people are coming out with studies very much consistent with the line that you're taking here. I just want to underscore that neither you nor I are social epidemiologists, though we are both quantitative social scientists trained specifically in the kind of inference problems that the lack of data that we have here in this situation called to mind. So, deferring to experts, nobody here, neither Wilfred Reilly nor Glenn Loury, are anti-science, are dismissive of expertise, are, living in some kind of dream world. But we are skeptical in the appropriate manner of how data are utilized to make public policy. And we're just asking questions. Can you endorse that?
Absolutely, strongly endorse that, Glenn, Dr. Loury. And I also will say there are tendencies you notice if you're in science and you go to the conferences. I mean, one is that apocalyptic predictions get published. You see this across global climate change modeling. You see this.
Oh, no, you didn't say that, did you? You're talking about taboos. That's one of the most taboo things
climate change.
Say.
We're all going to live. This is so. No, but I mean, we'll get back to climate change. The right sometimes does this when it comes to battle deaths or the necessity of warfare or something like that. But apocalyptic predictions get published. That's been known for a while. There's actually a well-known book by a couple of right-leaning but good scientists called Apocalypse Not that looks at the history of these doomsaying models. And there are tons of them, by the way. I mean, remember Paul Ehrlich's population bomb?
Oh, yeah.
Simple Malthusian math there. The world is going to become overpopulated. He didn't adjust for the impact of new technologies like birth control.
Well, he famously made this bet with this guy. I can't remember the guy's name now. It may come to me. The guy who was always talking about more people being good for humanity over the long run. I guess I can't remember his name. But they made a bet about what, say 1980, about what would be the situation 25 years out. And Ehrlich lost that bet badly.
Yeah, I know exactly what you're talking about. I can't remember either, but I think it was one of the
Simon. His last name is Julian Simon is the guy. People just Google Julian Simon, Paul Ehrlich, and you'll find out what we're talking about.
Yeah, the idea was a really well-constructed bet. The idea was that if more people are a negative, you would see the price of resources skyrocket and the use of those resources on a per capita basis decline. So they bet on the price of a bunch of standard resources, zinc and the like. And Ehrlich's claim was that this price would be through the roof and the resources would be less widely used in 10 years, I believe. And he lost across every resource. It turned out that as more people were born, and even that occurred on a shallower curve than was projected because of birth control, but as more people were born, you had more inventors, more scientists, you had more people digging to find this stuff. But I do want to say, Glenn, there's a whole series, mostly on the left, not entirely, of these incorrect scientific predictions over the years. So it's not just Ehrlich, it's the Club of Rome. Remember global cooling? The front page.
I do. And I was around in 1973 when we had that oil crisis thing going on. And people were talking about the price of oil was going to go up like this, like this, like this, like this. Last time I opened up the financial section of my newspaper, we were worried about an oil glut and the price being too low. Yeah, we're going to run out of hydrocarbons within my lifetime. And, I'm not as young as I used to be. I don't think it's going to happen.
Yeah, peak oil was a big one. The heterosexual and married AIDS epidemic, HIV, was going to sweep through everyone in that kind of hypersexual late 80s era. All that happened was people started wearing condoms, being a little more faithful. Just on and on and on. Global cooling, I already said that one. Killer bees in the Great Northerly Migration. The ozone hole, now that did require mitigation. Sometimes there's a real problem that we do need to engage. No one denies that.
Hydrofluorocarbons and ozone, yeah.
Yeah, we cut out one of the third most commonly used ingredient in hairspray. Don't want to be glib, but that was the solution. But just on and on and on and on. The trash land problem, will the world be overrun by landfills? Nuclear collapse, we solved that by using less of cleaner nuclear power, but the idea was there'd be 3 Mile Islands and Chernobyls everywhere. This just, again, there are entire books, like Apocalypse Not, that break these down. Acid Rain. I tend to have, looking at the major doomsday predictions on left and occasionally right for the past 55 years, I tend to have a strong bias that I'm acknowledging here toward the idea that we're not all going to die. When I look at that coronavirus modeling ticker and it says 13,000. We can mourn every one of those tragedies while still recognizing, hey, that's not 2 million. Once again, it seems like effective, reasonable mitigation, like standing 6 feet apart, solved the majority of the problem, one. And it also seems like the problem might have been a little overhyped in the first place.
Okay, now you're going to get, or I'm going to get, since you probably will not hear this, but I'm going to get a whole lot of flack from viewers. They're going to be citing Dr. Zeke Emanuel's piece that you might have seen just the last couple of days. If we don't shut down for 12 to 18 months, we're doomed. We have no choice. We got to shut down for a year because that's the only way to, as it were, kill the virus and make sure it's dead. Otherwise, we open too soon, it comes back. We'll be in the same situation 6 or 9 months from now with a resurgence, and we need to do this. People are going to find it irresponsible for me to even allow you at my platform to voice such contrarian sentiments. So I'm going to give you an opportunity to clean it up.
Sure. Well, I don't think there's any cleanup needed. I mean, the argument that I'm making that I think you have a substantial amount of sympathy with is based on major papers coming from a team of researchers from universities like Stanford. None of this is especially debatable. So in terms of the denominator issue, the only way doomsday predictions for coronavirus methodologically are sustainable is if the death rate among all people from the bug, COVID-19, would be equivalent to the death rate among the selected group of symptomatic seniors who have so far taken the test. I think that's wildly unrealistic. As a healthy male former athlete, I was told there's no chance I would get a test for quite a while. No, I'm not sick. But if I were to say I have a serious funky flu, can I please have a test? The response would have been exactly the same. The debate is about whether we're talking about 10 times more cases than we have tested for, which is what Mina from Harvard recently estimated, or 100, which is what the Stanford team recently estimated. But I don't see the doomsday scenario playing out. And this is part of a long thread, to some extent, of these doomsday scenarios not playing out. There also, by the way, this is another taboo, but there's a trade-off question here.
Yeah.
So, I mean, if we picked a near worst case estimate for deaths using the models you and I have been bringing up, say 400,000 individuals, and this were the alternative to shutting down the country for 18 months, which would cost $18 trillion, it seemed to be a fair estimate looking at lost GDP, we'd have to very seriously discuss that. The unfortunate fact is that human beings, not being gods, are by definition mortal. So many, many things kill us. We're a short-lived predator species. About 50,000 people per year are killed just tooling around on the highway. 450,000 people per year are killed by obesity, essentially. If you look at the impact of that on heart attack, other diseases, cancer takes even more human lives. So if someone were openly to say, you have to shut down your entire society for a year and a half or people might die, the response to some level has to be, well, people already die. Let's weigh the costs and benefits of that. I don't see something like an 18-month shutdown as being at all feasible.
It's a separate question. I'm sorry. I'm sorry to interrupt, but I just want to be clear. Feasibility is a separate question from the relative valuation question. I'm with you on both. I think feasibility is very important because if you undertake this and it's not feasible to maintain it for as long as it would need to be maintained to have a definitive impact, then all the costs that you incur from undertaking it, when you finally do have to relinquish because it's not feasible to sustain it for a year and a half, will have been incurred to no effect. So whether or not to go down this policy road in the first place depends in part upon a judgment about, can we sustain this kind of thing for the 18 months that will be necessary to make this thing absolutely go away? And if the answer to that is no, you need to reconsider at the start whether or not you want to go down that road. That's a separate point from the point about whether or not 8 or 10 or $18 trillion of national wealth is too high a price to pay for 50 or 75 or 100,000 deaths. Both of those questions, it seems to me, should be on the table. Neither one of them is speakable at the moment. Yes.
And I'm just going to say this. If we're currently valuing 100,000 lives at $18 trillion, Glenn, we can never fight another war. Unfortunately, in any sector of elite business, if you're looking at the building of bridges or of jet planes, in any arena of the military or the military sciences, in politics itself, we unfortunately often make calculations that do incorporate the valuation of individual human lives. If you've ever done union work, at least thinking back to the old days, they'll hand you a card on about your fourth day that tells you what your eye or your leg is worth if you lose it. It's a substantial amount of money, but less than I value my eyes and legs for. But we realistically...
Well, let's do the arithmetic. If it were indeed $18 trillion, and if it were indeed 100,000, that's 100 into 18 billion. By my calculation, that's $180 million a life.
Yes.
And last time I checked, that ain't anywhere close to what an insurance company will pay out if you have a claim.
Yes, that is a very high figure. I'm going to be as polite as possible because this is such a serious topic. In general, if you've ever done skilled union work, as I suspect you probably have, or you've ever been in a military role, or you've ever just been in business and you've looked at how something like the risk plot projection for building a bridge is calculated, the typical value of a human life, and anyone watching this is free to Google this, is set usually at about $10 million. And there's a definite reason for that. I mean, that's a solid middle-class income even today, over 100 years times 2. So if you're saying the typical valuation is a solid middle-class income over a century doubled, and you're talking about 18 or 20 times that, you're going to find that very, very few societies are going to be willing to pay that bill. That's all I can say. I'm not an extraordinarily moral person. I'm not a priest, not a bad one either. But that is very much out of whack with anything we've ever seen throughout human history.
But now, and we're talking about taboo, at least we thought we were talking about it. We might get around to it in due course. But now, speaking of taboos, a politician simply can't say.
Yes, this is a problem.
Okay, and this is interesting from the point of view of public leadership and public decision-making. Simply can't say, that's too much to pay to save a life. I will take this course of action, even though I know it's going to cost lives, because I don't want to take that course of action, which will cost too much money. That's simply not something that can be said.
Well, but to some extent, I think you've just identified a structural weakness of democracy. Ariston of Athens, I believe it was, once made this argument. But at some point, a general or one of these governors that has emergency powers or something like that has to say this. I mean, there has to be a statement at some point. If it costs $18 trillion to save 100,000 mostly senior lives, we will try to quarantine seniors as best as possible. We will cry and pray for every life lost, but we are simply not going to do that. We are not going to destroy our economy and our society to avoid paying this price. And to a certain extent, it would be cowardly to do so. I
just want the audience to understand, we are not, the $18 trillion number is just a number, okay? We're not serious about saying that that's what the cost of a shutdown is going to be. Though I will note that that's about 1 year's worth of GDP in the United States of America. And if you completely close down the economy for a year and a half, numbers in that vicinity are not implausible.
Yeah, I think that's a roughly accurate estimate of the cost of an 18-month shutdown if you're talking about a $23 trillion GDP. Yeah, that was not just a number. Obviously, that's not the real number. That's not exactly what we'd see. It could be 12.
But it's not a crazy number to be talking about if you would have followed Dr. Zeke Emanuel's advice and shut the country down for 18 months.
My personal opinions, and again, I am fairly skilled quantitative methodologist. I'm not a doctor. I welcome comeback from virologists and so on here.
Sure.
But looking at what I've seen in the published papers, to me, the sanest options regarding coronavirus seem to be one, randomized serological testing now. We can very easily find out there's not an enormous problem, quite frankly. If we find out that 40% of people have already had COVID-19, which is not an unreasonable estimate, in the Lombardy region of Italy as of last week, it was 70% when they finally started serological testing. And that indicates that those terrible wildfire numbers we've seen come from basically the whole population, by the way, which is awful as that sounds is good news. But randomized serological testing today, I suppose the second point would be the kind of serious social distancing that the Brits didn't initially think we were going to do that you see if you go to a Kroger. I mean, where there are stamped placards on the floor saying 6 feet apart, people are extraordinarily polite to one another, hands are washed, you have a sanitizing station, costs $10 to set one of those up. We did on the KSU campus. That would be step two. ideally, I would like to combine that with as close to a hard senior quarantine as you can get. One of the things we see with COVID-19, another taboo, as you might put it, is that the stuff you're supposed to say, like this virus has it in for everybody, isn't really accurate. I've been following the NYC data day by day. And as I recall, the most recent date, about 1,600 people died, and 11 of them were people under 65 with no serious pre-existing condition. If you go to ny.gov, they give a short list of these conditions. They're not just making up random medical things. One of them is asthma, severe chronic asthma. But out of 1,600 people, 11 were people without conditions like chronic asthma who are under 65. I don't know whether it would be legal to lock the most vulnerable people in their houses. Arguably not. But I mean, at the same time, it's not legal under most circumstances to cancel church services. The closer we can get to real protection of the most vulnerable, as kind of a 0.3 here, the better. Whether that means terrifying ads saying if you go outside, you'll die. Whether that means what we're seeing in Kentucky, which is coordinated community networks delivering products to, say, seniors with PEC. I really like that idea. I encourage everyone to do that if they can, volunteer locally. But the closer you can get to protecting the small fringe of very vulnerable people, the better. So serological testing, Swedish model improved. You can just go to a Walmart and see how well this works. Protection, to put it politely, of the vulnerable group of individuals. And I also think there's a place for regional flexibility. That strikes me, and I didn't come up with these ideas, they're in the papers. That strikes me as a coherent long-term model for beating COVID-19.
What's the paper again?
Oh, there are a bunch of different papers about this.
Okay, so the ideas are in the newspaper. That's what you meant?
No. I mean, there are a bunch of different. So one link that has several of the scientific papers, and it would be Fortune. Does Iceland have the best approach for fighting coronavirus? Another example would be one of the leading British magazines. Their headline was something glib, like if Sweden pulls this off, we're screwed. But they include some very serious data in there. A more serious version of that same article would be called, and this, don't think it was peer-reviewed, but kind of Quillette-level intellectual joke location was, Sweden believes the rest of the world is making a dangerous, ill-informed choice. All of these headlines to
and again, we want to underscore, Sweden has not instituted nationwide lockdown.
No.
They're proceeding under more or less a rubric such as you just got through describing.
Yeah, and one thing that's worth noting here is that they're not alone. I mean, there are quite a few countries, and we can get into the impact of race and class diversity here, another taboo. But I mean, they tend to be smaller, homogenous states. But there are quite a few civilized countries that we're friendly with that are following basically the model that I just laid out in conversation with Glenn. So okay. Japan, South Korea, Iceland. Sweden's not a one-off waiting for an avalanche of death. The question is...
I gather going back to school in Austria next week or something like that.
Yeah, the impression I get is that they feel they overreacted a bit. They haven't really seen a massive slowdown in cases, but they also haven't seen many cases. They're opening the schools. And again, the question isn't, should we do nothing? Now's not the time to take your grandmother to a bar. The question is, if we're doing extremely intense social distancing, people standing 6 feet apart, washing their hands, using Lysol wipes on the cart, doing some of the things that we probably should have been doing all along if you look at how many people flu kills every year. But if you have that, one, and alternatively, two, you have a full lockdown, does the full lockdown scenario save enough more lives than the SD scenario to justify the $1 trillion cost? And I will be blunt, I don't think it does. I don't think a lot of people at that gubernatorial level think it does. There's, to some extent, you illustrated the democracy problem very well. Who's going to be the first guy to say this?
Yeah. Well, let's talk about the racial disparity issue for a minute, and then perhaps we can get to your book in the next conversation that we have, because I really do appreciate you as a serious quantitative social scientist, and that's what Wilfred Reilly is, engaging with me around these questions. I think the public discussion has been insufficiently open on this, and there's a herding kind of tendency for everybody to get on board, do the patriotic and right thing. And as I think also, Will, and I wonder what you think about this, contempt for the president that is so widespread has, I think, helped to fuel this environment that we're in which it's not easy to question conventional wisdom that advocates significant restriction of economic activity, since it's well known that the president would like to, quote, open the country up, close quote, sooner rather than later. So what do you think about that? The last thing I'm saying, contempt for the president adversely affecting the quality of our public discourse. And what do you have to say about, I'm seeing these stories daily now. Nicole Hannah-Jones has a very long, much circulated tweet in which she chronicles the extent, nature, and the extent of the racial disparity in the incidence of COVID-19 disease. What do you have to say on those 2 points? And perhaps we can wrap it up.
Well, I mean, Nicole Hannah-Jones, who we've professionally sparred with in roles at the 1776 Initiative, also said the Revolutionary War was fought to protect slavery. I mean, I don't have any comment.
Okay, so forget her. Let's not take her seriously, but the issue of disparities is out there.
Yeah, so my honest opinion on this, first of all, my initial reaction to this being brought up was disgust. Not that Black people might make up a slightly disproportionate percentage of those to fall.
It's more than slightly.
Well, that's because they're using
Chicago, they're 3/4 or so of the cases and 30% of the population, et cetera.
That's because they're using selected city by city data. I guarantee you that's not true in Appalachian Kentucky. But that actually is one of 3 points I'll get into here. But my first reaction was sort of disgust. While we're battling a deadly disease, even if perhaps not as deadly as the media would like to tell us, it really isn't the time to try to divide the highly integrated professions on the front line, like nurses, police officers, and so on, with this kind of racial bean counting. I was very surprised to see major publications run that stuff. As re the actual question itself of racial disparities, I think there are 3 obvious responses from what we keep referring to as that scientific or that methods perspective. One is, are there racial disparities nationally? So, I mean, I guarantee you I could go to Lexington, Kentucky, much less Hazard, Kentucky, and find that a great number of those did happen to be poor whites and say, oh, look. And the legitimate response to me is to say, Reilly, you're in urban Kentucky. That's totally invalid. That doesn't necessarily represent anything. So when the very few times, and I haven't done this for weeks, I'll do it right after the show, but the very few times I've looked at deaths across the USA, you have to notice that the large majority of them are older whites. So you simply have to notice that. Look at the average age. Look at the average age for the white population versus the Black population. Many ways to do this. So first, I would question whether that's true at all on anything but a localized macro urban level. 2, the most obvious question here is, do Blacks, whites, and other groups score equally when it comes to serious pre-existing conditions that don't have anything to do with racism, like diabetes and obesity?
Hold on. Many people will say they do have something to do with racism, and then they'll have an argument about food deserts or about, environmental proximity to dump sites and things of this kind.
So first of all, you can argue. The argument of the hard activist left for about 50 years has been that literally everything is racism. So if I were to point out, well, if you adjust for obesity, this disparity goes away, as I strongly suspect it would, someone might say, well, that's racist. I personally don't think having access to too much good food and this thus being fat is an indicator of racial oppression by any conventional past human standard. But even then, if you're saying that it is, we would then have to adjust for class, right? Are poor whites any less likely or more likely to be obese than poor Blacks? I think leaving that, because this is a high level debate, just at the most basic level, assuming that asthma isn't due to racism, the second question to be asked after are there discrepancies at all nationally is, to what extent are those explained by external health variables? But a third point that, again, is taboo by the book, but a third point is, are people following the shelter-in-place guidelines to the same extent? This is one of these that we're probably not supposed to talk about.
And by the way, we don't really know, but at least the possibility could be entertained.
Well, I can tell you, I live in a working class white and Black neighborhood. And I've been asked to play 5-on-5 basketball over the past couple of days.
Yeah.
If you go down the street, I'm not going to tell where the court is so people can go snitch on someone out there with their son. But I mean, if you go by some of these venues, like an urban basketball court, you're going to see a ton of people, many black, many working class white out there. So you've got to ask at some realistic level, are all people across class lines and racial lines following the same guidelines? And if not, wouldn't that almost totally explain any discrepancies?
Here's what's going to be said. What's going to be said is, no, they're not following the same guidelines. All right, you want to do your study, do it. You'll find that blacks are not maintaining on average the same degree of social distance, but they can't. They have to take public transit to get to work. They're the ones who are going to have to be delivering your food or whatever it is. And because they don't have the privilege of being able to telecommute to their offices, are structurally predisposed to be in a situation where they're more likely to catch the disease. So yes, Reilly, you're right. They're not social distancing as much, but you're wrong. It is racism at the end of the day that explains that, because of the structure of people's occupations, where they live, what kind of transport options they have, and so forth.
I think that racism has to have a real meaning. I mean, for a century, it meant disliking members of another racial population for genetic reasons. That's still kind of where I am. I mean, what you're describing is a very complex lattice work that people sometimes use to say you can't disentangle race from region and class when you're talking about these issues. But yes, you can. If you're running the most basic standard regression model and you find that African Americans are more likely to suffer from a deadly disease, which is a thing worth studying, than Caucasians or Asians or whatnot, the next question would be, is that true if you adjust for income and region? And I would strongly, strongly bet that it probably isn't. So are you talking about a race issue, or are you talking about a class issue, or are you talking about an urban issue? This is another thing. This is one of those gaps that's hardly ever discussed. African Americans are more likely to live in cities, which in fact have a higher on average income than the surrounding rural areas, but which have more people. If you're comparing the death rate of people white or black in New Orleans, which is the city they seem to keep focusing on, with the death rate of people white or black in Montana, of course, you're going to see more black people in the category of the fallen, because there are more black people in the urban setting and virtually none in the rural setting. Yeah. So this gets back to the same point, sort of, for me. Before you can even argue this, you would have to look at whether the discrepancy continues if you adjust for urban status, if you adjust for class, if you adjust for region. I don't think it does. I can't imagine that there's some sort of genetic reason or reason based totally in racism why a working class white guy is less likely to get COVID-19 than a working class black guy. That sounds fantastic.
All right, let me just make a methodological observation here. It'll be trivial for you, but I think some listeners might appreciate it, which is the disparity. No one's denying the existence of the racial disparity. The question is about causality. The question is whether or not the fact of the disparity is indicative of some remediable maltreatment or differential treatment or discrimination to which the African Americans are subject. Once you take into account all the other non-racial factors that might be involved in this situation, the raw disparity as a statistical matter probably can be accounted for. We haven't done this study, but you need the data. This is the final point that I'll make. Because one of the policy issues that's being debated is, should the public health officials be required to collect data by race in the midst of this pandemic? And I'm inclined to say yes, if only for the opportunity to make use of those data to dispel the kind of conspiracy theorist, racist narrative mongers who are going to take the disparity and use it to run with it to push their narrative.
Yeah, I agree. I mean, I think almost always more data is better. That's literally the baseline of both of our professions. I mean, and what you just said there, Tom Sowell summed this up in the title of one of his books, Discrimination and Disparities. There tends to be an idea on the political left that any disparity is due to discrimination. So, for example, I did this on the air about a week or two ago, but it's frequently mentioned that the average black man earns 84% or whatever of the average white man, attributed to racism. That gap almost entirely closes if you adjust for age, years, rather than quality of education and region of the country. Brothers are more likely to live in the South.
And IQ.
Yeah, well, IQ is the second part. So the gap was 16%. If you adjust for age, years of education, and again, not quality of education, just go to school, stay in school, don't get arrested while you're in school. Age, years of education, and Southern residency, basically, the gap closes to 5%. If you adjust for tested IQ score, the gap closes to 1%. And you could ask, is that the actual level of hardcore residual racism in the USA that an upper middle class black person would face, 1% to 2%? Not really prepared to comment on that, but the figures are there. So the gap itself, before you make the adjustment, is meaningless. So that's one of them. I mean, another one would be test scores. Without getting into more complex and taboo issues.
Let me hold you off on that because our time is running short. And I wanted to get your comment, if you're willing to, about whether antipathy toward the president had somehow filtered into the public discourse in a disadvantageous way.
Of course. Yeah, I mean, I lean right, but not extraordinarily far right. And I don't think that this comment really comes from a partisan political perspective at all. I mean, the media doesn't like Trump, hates the guy. They always viewed him as a crass, long-tied New Yorker, and they ran for president as a Republican. I mean, so there are studies. Pew found at one point that 94%, you might correct this, but 94% of media coverage of Trump was negative. And I think that level of dislike, and Trump has not responded to this in the most mature way either, calling CNN fake news and throwing reporters out of press conferences. But obviously a back and forth famous feud between the president and the top journalist contributes to this. And you've seen this in a discussion of issues that should really be kind of neutral scientific questions. So, I mean, hydroxychloroquine is the apex example here.
Yeah.
This is a chemical that's used to treat malaria that appears, reading through what a number of doctors have said, including doctors in my area, to be useful in the treatment of COVID-19.
Too early to be sure that it's safe, but certainly there are indications in that direction. Yeah.
Yeah. And I mean, many doctors in France, this has just been approved to treat COVID, as I understand, in Italy. And many doctors are asking for kind of boosted stockpiles of the stuff. So there's a debate here, and I think the evidence is 66 or more % on the side of the hydroxychloroquine probably works, my personal opinion. But it's sort of a dry scientific debate, and the media has managed to turn this into Trump is encouraging people to drink fish tank cleaner. Because it turns out that one of the sources of a cruder form of hydroxychloroquine is what you use to keep, your beta tank clean.
Well, those are the extreme anti-Trump claims. The more mainstream claim is that he ought not to be advising the use for clinical purposes of a treatment which has not yet been certified scientifically to be safe and effective. That's simply an inappropriate way for him to use his platform.
Well, I think that, again, this gets into the bureaucratic dominance that we see in our society, where you mentioned that you and I, who've written written books that include methodological chapters, might be criticized for discussing this at all. We keep emphasizing, well, we're talking about the methods, not, the horror of disease. The idea that only people in a particular narrow field can comment on something, and they can do so only after peer review, is not in practice a valid way for conversation to take place. I think obviously we ought to weigh the opinions of in-field experts more. But if some highly intelligent person, as you did during this show, or I did, gives a disclaimer, although I'm reluctant to call myself highly intelligent, but if someone gives a disclaimer and says, okay, I'm talking about the numbers here, this guy said this doomsday projection will happen if 80% of people get sick, and I have a question about that, there's nothing at all wrong with that point being raised. Same thing with Trump. If Trump says, I'm an intelligent man, I'm the president of the United States, I've read 4 or 5 papers on this that are somewhat inconclusive, but I know that doctors around the world are requesting this treatment. Let's look at it. I'm not at all horrified by that, as long as the disclaimer is there.
Yeah.
The other, by the way, in terms of trade-offs, the other option is people not taking hydroxychloroquine to probably die. So again, there aren't a lot of solutions in life from a leadership perspective. There are a lot of trade-offs.
I just want to underscore one point here as we conclude, which is the role of expertise within the context of public discourse about complex, multifaceted problems. Certainly there's a role for expertise. I'm an economist. There's a role for economic expertise in advising about the economy. There's a role for social epidemiology expertise in advising about pandemics. But experts should be on tap, not on top. That's the way that I would put it. Experts should be available for consultation by political decision makers, but ought not to be delegated the responsibility for making what are ultimately value choices, since ultimately public action has to weigh the relative significance of many different factors about which an expert is only expert on one of them or two of them.
Yes.
So this tendency, which I think is very much driven by the climate change debate, the climate change argument, which will be going on throughout our lifetimes, I reckon, this tendency to argue for deference to experts runs a risk. Of course, know-nothingism is bad. Burying one's head in the sand, saying I'm going to pray and everything will be better because God's going to take care of it. That's no way to run a railroad, okay? But because a person has a PhD doesn't mean they're wise. Neither does it mean that they are responsible for the well-being of us. That's what we decide at a ballot box. And that's a concern that I have in this climate, that this kind of stampede toward deference to expertise will obscure the normative dimension of our problem. Value this versus value that. And how that question gets resolved is not a question of science.
Yeah. So I think there are two things there. First of all, I'm an advocate of what people from Tom Sowell to Cicero have called the tragic vision of human reality, which is that civilization is rare, it's complicated. There are lots of people who seem ordinary, scattered throughout civilization, who have superior knowledge about their small selected field, i.e. farming. And as a result of this, the view of society as a whole, expressed through elections or even silly things like Twitter polling, is very, very often, if you limit the conversation to people qualified to use the tools, if there are rules on what you can say, the general opinion of society is very, very often at least as valuable as the opinion of a selected 4 or 5 man team of experts. That was one of the major problems in the Soviet Union, actually. It turned out that the best economists in the country weren't quite as good, with no criticism of the science of economics, but were not as good as the marketplace containing millions of Russians in determining what products people wanted. This is one of the basic ideas of an economic centrism or conservatism, and it doesn't go away in this one sector.
It's very Hayekian. This is Friedrich von Hayek right to the core.
Yeah, I would swing a little to the left of that, but yeah, it's the basic.
Well, I mean, the idea about information and about the decentralized character of how we know what's going on in the world. No one of us knows everything or very much of anything.
Correct.
Collectively through the marketplace, the decentralized information that we have collectively gets expressed in prices. That's the Hayekian idea I'm referring to.
I was teasing a bit. Yeah, I agree with that. I think I'll give an example here. Looking at the COVID-19 discussion, there was a blog written by a tech executive whose last name is Pueyo, Puyeyo, I think, if you want to read this, where it called The Hammer and the Dance, where he argued that we absolutely have to shut down to stop coronavirus or we'll all die. And this was another one of these blogs, or another one of these pieces that just sort of made assumptions. Like one line was, let's say the death rate is 4%. Let's say the infection rate is X. And this gathered hundreds of thousands of views online. And I remember being part of a thread of people, mostly college profs in their early years or junior scholars, but just looking at this and commenting, like, where does the 4% come from? Why would you assume this infection rate? Someone just bluntly asked the question, did you just make this up? Someone threw up the Ioannidis paper, which is where I found it, and said, what about this counterpoint infection rate? And that's what a real conversation looks like. Pueyo, who I assume has a medical background and who's, a C-level at a major tech company, would be the expert. But not one of the people responding to him, but the 300 almost equally qualified people responding to him were able to take down the entire argument. So I think that secondary level of discourse has to happen. Another point that you raised that I hadn't really thought about much, experts are only experts in their field. So if you're a virologist, I yield to you when it comes to maximum rate of viral spread or even the horrors of watching, a disease victim's skin melt away or something like that. But that virologist is not more qualified than you are to comment on the economic impacts of an 18-month shutdown. And for that matter, that virologist is probably not more qualified than either of us to draw up a modern quantitative model. Doctors, I don't find, tend to be the best at doing that. that projects what's going to happen over a period of 6 months. So if a methodologist jumps in or an economist jumps in and says, are you considering this? That's totally valid. I don't think either of us is talking about how to manage an ER. I would never even presume to do that in a casual Twitter conversation. But if someone says, look, you claimed a 4% death rate, that's scarlet fever. Why, bro? That's a valid question to ask the expert in their field. Are they an expert at quantitative methodology also? Are they an expert at Keynesian or Hayekian economics? Probably not.
Yeah. All right. We're going to leave it there. Thanks for coming on the program, Wilfred. You've given us something to think about, and appreciate you. I really do. So take care of yourself.
Yeah, always enjoy talking to you as well, Glenn. Thanks for having me on. Next time, we'll probably discuss Taboo a little bit more.
Yeah, we will. Let's give it a few weeks or a couple of months, maybe something like that. Let's see if we're still around at the end of the summer, something like that.
We're almost all still going to be here.
I sure hope so.
All right. Have a good day.
Right. Take care.